From the News Channel 5 Network, this is Morningline with Nick Barris.
Good morning, everyone. Thanks for joining us on Morningline. Nick Barris here with you on a Wednesday. We have a good show on tap for you and invite you to join in the conversation as we talk about your heart and heart health and the like. It may look as though I spilled some ketchup on my lapel here, but it's actually one of these pins that they hand out that raises heart health awareness this time of year. Every February we do a program along these lines, and the role it plays with regard to heart health, especially with regard to women and the like. And we always like to have a guest come on to talk about the very latest on that front, and you're invited to join in the conversation if you'd like. But this morning we're joined by Dr. Joshua Beckman. He's a professor of medicine, director of vascular medicine at Vanderbilt University Medical Center. Good morning to you, sir. Thanks for joining us.
Oh, such a pleasure to be here, and such a good cause.
Well, it is a good cause, and you're here also in association with the Heart Association, right?
I am. Yes, I'm very lucky that I get to volunteer and spend my time trying to help out the public's heart and heart health and all those good things.
If you would, for our viewers, explain. Now, what kind of heart doctor are you?
I'm a very good one.
Okay, well, I had no doubt about that, but I mean, are you someone that actually will do surgery? Are you someone that works with patients that have high cholesterol? What kind of doctor are you?
So I take care of patients in the office primarily, sure, and in the hospital, but I do not do surgery. I'm not the kind of person that's going to use a knife or even do angioplasty. I leave that to others who have better hand skills.
But you may help with the diagnosis and then the treatment after the fact, correct?
Exactly. My goal is to figure out what's going on, get you on the right medicines, get you on the right path towards exercise and a healthy diet, and try and keep you out of the operating room and the angiography suite.
Well, you know, the reason we do this story and we have this event every year is heart disease still, despite all the efforts and everything that we've developed, remains the #1 killer in the United States. #1, right?
#1. Also #1 around the globe.
Okay, and is there why is it? For instance, what is it about heart disease, say, compared to cancers or compared to even nowadays COVID-19, that makes it such a killer?
Well, I think the most important thing is that it's incredibly common, and that a lot of the behaviors that we all enjoy in the United States, the kinds of diets that we have, the things we do like cigarette smoking, some of the sedentary behavior, all make it more likely. I will say, and I don't want to downplay this, it killed by a percentage amount twice as many people, not just 30, 40 years ago. And so we've made tremendous strides, but we still have a lot of work to do to really stamp it out.
Okay, that makes sense. And I know that when we talk about heart disease, how many people it kills, it seems to me that in most cases, except for some genetic instances or just oddities that come about, a lot of it can be prevented. You just touched on it. Cigarette smoking, diet, exercise, those kind of things come into play. Now, when you talk about someone who's got like pancreatic cancer, I don't know what you do to prevent getting pancreatic cancer, all right? That just pops up, it seems to me. I know there can be causes. But heart disease, what percentage of cases of heart disease do you believe, had the individual perhaps lived a bit differently, could have prevented it?
So I would say that there's a lot of room for improvement, and that there aren't that many people that don't have one of the risk factors for heart disease, like high blood pressure or diabetes or cigarette smoking, that develop heart disease, or certainly develop it early in life. I think if we avoid those kinds of behaviors, we could get rid of at least another half of it. That would be my guess.
That's what I would think. We've heard that time and again. Now, I was looking at this statistic. I mentioned COVID-19 a moment ago. CDC says nearly 3 out of 4 patients hospitalized with COVID have a heart condition, which I guess makes heart patients obviously one of the very high-risk groups. And is there a connection, or can you explain, obviously, what that connection is, why heart patients may be higher at risk for COVID, or is it just in general anyone with a health problem?
I really wish I could give you a single answer as to why that's the case. I think that's one of those mysteries that we're trying to figure out. I will say that patients with high blood pressure, patients with diabetes, those are patients who are older, are all the ones who seem to be more at risk for COVID-19 and bad COVID-19. And I think there's at least a combination effect here where if you have those things, then you're also more likely to have heart disease. It's very clear that the sicker you are, the worse you do with this.
Okay. And as far as folks suffering from heart disease, it is pretty rare, except, as I said, in those instances where there may be a genetic anomaly or something like that, to have heart disease, is it not? In young people, maybe you can define for me what young people is, and then tell me at what age really we start seeing heart conditions manifest themselves the most.
So young seems to get a year older every year that I get a year older. But I would say that I think, first of all, that there's a lot, if you pay attention in your 20s, 30s, and 40s, you could really stave off a lot of the problems for a while. But events really begin to take off for men once they crest 50 and women once they crest 60. That's where there really seems to be a significant increase.
Okay, and I guess your point is a good one. You know, hopefully you're aware maybe of your family history like I am, and because of that, I tried to be cognizant of it, you know, back when I was in college, you know, even, and you know, you're in college, you think you're bulletproof, right? But I mean, I saw that, you know, I had family members that had heart disease and some that had died from it, and so I started kind of paying attention to it. So I like to think that maybe from my perspective, I tried to set the table. I never smoked, you know, I tried to eat well, you know, I'll eat my share of Big Macs, but it's like, I think I'm doing better now that I'm over 50 because of the way I took care of myself earlier when it really wasn't a major factor for me.
I think that's definitely the case. We know that people who don't pay attention to these things early on are more likely to develop problems later on. And so there's never a wrong time to start to do the right things to make yourself feel better and live longer.
Right. Is it too late to start after you're 50 if you've just thrown caution to the wind?
No, it's never too late to start. And in fact, improving, say, your blood pressure control, stopping smoking, improving your diet, getting more exercise, each one of these things separately and together is associated with doing much better over time.
All right, I've got a lot more questions for you. I love this topic, and I love talking to you because I learn so much. My heart's important to me, and I, want to learn as much as I can. But we've got a few phone calls. Before we take our first break, I'm going to squeeze in Joe, and he's always first on the line anyway. So let's take Joe. Joe, good morning.
Good morning, Nick.
Hi, Joe.
Good question for the doctor. Someone that's type 2 diabetic and is being diagnosed with pulmonary hypertension. What is the treatment for the pulmonary hypertension?
Okay. Did you copy that all right, Doc?
I got it. It was very clear. It's a wonderful question.
Okay.
There are actually a whole bunch of different types of pulmonary hypertension. Some of them are related to your heart, if your heart's not working so well. Some of them are specifically related to the lung blood vessels. And then there's some other associated conditions like scleroderma, for example, that can cause pulmonary hypertension. And the treatments vary a bit depending on what the cause of the pulmonary hypertension is. It's certainly a serious condition, and it can make you feel short of breath with really very little activity. And I think it's one of those things that you'd really want to talk to your doctor about to see what your specific type of pulmonary hypertension is.
Okay, let's take Ann next. Ann, good morning. Hi, Ann.
Good morning. I'm in my mid-60s, and I am allergic to statin medicines, and for years have known I have high cholesterol, but recently have been tested and, I guess I'll be treated for high calcium in my coronary arteries. One is the fact that I have to take extra vitamin D for medications that I am on for autoimmune problems affect the amount of calcium that is building in my arteries. And two, how is that treated, as this is not something I anticipated? I am an avid walker, doing anywhere from 12 to 15 miles a week because that's about all I can do as far as exercise goes. But how is that treated?
All right, great question.
Two really good questions. First, Your vitamin D is not a part of the treatment of heart disease, and you taking vitamin D for another question or calcium for another medical problem is not causing the calcium in your heart vessels. The calcium in your heart vessels is actually a marker of cholesterol plaques or atherosclerosis. And so what you need is the standard treatments for atherosclerosis to make sure that those plaques are stable and they don't break and cause things like a heart attack. So what I would suggest is you talk to your doctor about other ways to lower your cholesterol if you can't take the statins. And there are a few people who can't take them, although really most people can. But there are other medicines now that you can try, and you really want to control your cholesterol. You want to control your blood pressure. I want to commend you on doing the exercise. That's really great. And you want to make sure that your diet is as good as it can be. And I don't think you told us you smoked, but you certainly want to stop that. I think what you have now is an early warning sign that there may be plaques there, and now is the time to be as aggressive as possible to stabilize things and try and avoid anything going forward.
Great advice. Listen, Doc, take a break. We're going to go to a commercial. When we come back, we'll take more phone calls. I've got some questions more. I want to follow up on the statin that she was talking about, and we'll talk more about heart health. You're welcome to join us if you're watching right now, 737-7587. Any questions, the doctor will do his best to answer them right after this. Stay with us.